When I first walk into a room and I'm encountering a patient for the first time, a lot of their complaints can be fairly different, whether it's a mobility issue that they're having or if they're in pain, what have you. You really have to understand what the patient is telling you and how you can further treat that. So how I approach medicine is you really have to take a detailed history and get all of those components to what they're saying, what's happening in their life, that their pain is being affected, that this medication's not working, they've tried therapy, they've tried certain things, that we would send them to one of our pain management specialists that's also practicing in our group, or we have the option of treating them surgically. So it's really focused on the patient and what they would prefer and what they need in order to give them their life back. A lot of the medical terminology that we use in spine is very complicated. So what I like to do is while we're in the office, we always get x-rays. So I'm a very visual person and I try to convey that to our patients. So for an example, if a patient has a spondylolisthesis, which is a slip of the two vertebrae on top of each other, I would show that to them on the x-ray and how the alignment is supposed to go and where their issue is that they're having. When people are first confronted with spine, and especially spine surgery, it sounds very scary. Like everyone is always like, oh, how can you do spine surgery? Aren't you nervous like somebody's gonna get paralyzed? Or this is such a big surgery. And that's kind of a misconception with what we do. A lot of our procedures are minimally invasive, so we really have a tight area that we're working with, and that I just try to explain to people who don't really understand spine surgery is what it is that we do and how it's a lot safer than it used to be.